Hi, my name is Dr. Michael Corey, and welcome to this short video that we're going to do today. And I want to talk to you about thyroid dysfunction. You're probably watching this video because you or a loved one is experiencing thyroid symptoms. Now, when we talk about the thyroid, I want you to understand that virtually every muscle, cell, tissue, and organ of your body is dependent upon the proper amount of thyroid hormone to regulate its metabolism. That's right, virtually every muscle, cell, and tissue of your body is dependent upon that thyroid. So we have to have proper function, otherwise we're going to have symptoms. And some of the common symptoms are things such as fatigue. No matter how much sleep you get, you're just completely tired, you're exhausted all the time. We can have unwanted weight gain. No matter how much you exercise, you're never losing the weight that you feel like you should with the energy and with the efforts that you're putting forth. Maybe you're experiencing insomnia. We can have thinning of the hair or hair loss. If your hair is falling out in clumps and you just don't understand why, we have to sometimes look at that thyroid and find out what's going on with you. We can have anxiety, we can have depression, we can have cold hands and cold feet. No matter what you do, you just want to put socks on at night, or you want to bundle up and put extra blankets over your hands or your feet. Well, that once again comes back to very often a thyroid disorder. Other symptoms that people are experiencing when we have thyroid dysfunction are consistent and intermittent headaches. Maybe they come on in first thing in the morning, and as the day progresses, they start to calm down a little bit. So these are just some of the symptoms that many of my patients with thyroid disorders come into the office and they have chief complaints about. So when we talk about the thyroid, one of the first things I want to talk to you about today is we're going to talk about the brain. So we're going to put this here and we're going to talk about the thyroid. And from the thyroid, the brain is very, very important. It regulates everything you are as a human being. But there's three areas of the brain that are very, very important that we have to look at. And the first one is what we call the parietal lobe. The parietal lobe is housed on the outer area, up in this area here of the brain. And from the parietal lobe, you're going to be experiencing, if you have dysfunction in that area or decreased firing or stimulation of that area, you're going to be experiencing pain. Many patients come into the office and they have pain. Well, it's the parietal lobe that's responsible for your ability to detect it and feel that. The next thing we're going to look at is we're going to look at the frontal lobe. The frontal lobe, on the other hand, is where all of your executive decisions are made. You also have a long-term memory in that area. But a lot of our patients that come in the office, they say, well, you know, I walk into a parking lot and I don't know where I parked my car. Or I walked into a room and I don't know why I walked in there. I go through and no matter what I do, I feel like there's a brain fog. Okay, I just can't think clearly. Well, very often that's due to that frontal lobe not firing or getting proper stimulation, activation, and a fuel supply to that area. The next area that I want to talk to you about is the temporal lobe. Because like the frontal lobe, it has to do with short-term memory. And what I want you to understand is that when our brain is not working properly, then we're not going to be living the life that we deserve. But the brain and the thyroid have to have an equal communication at all times. So when we have these symptoms here, very often what will happen is the brain will not function properly and we get this brain fog. And the next part that I want to talk to you about as far as with your thyroid is we're going to then talk about your colon. When you have symptoms of colon dysfunction, you might be experiencing bouts of diarrhea. You might be experiencing bouts of constipation. And you might be experiencing IBS symptoms or irritable bowel symptoms where you fluctuate in between. Well, this is very, very common when we have colon problems. So those are the symptoms of a colon dysfunction. So we don't just have a thyroid problem, we have a colon problem. When we look at the next one down, we're going to go back and we're going to then look at your stomach. If we have a stomach problem, you might be experiencing things like stomach pains. You might be experiencing bloating or a lot of gas. You might be using antacids. Maybe your doctor just prescribed you a symptomatic relief for your stomach and he's recommended over-the-counter antacids. Well, what I want you to understand is that with that stomach problem, that's going to affect the thyroid. So we don't just have a thyroid problem, we have a stomach problem. The next part of that is we're going to talk about your small intestine. When we talk about the small intestine, I want you to understand that symptoms of small intestinal problems can be nausea. You can have unwanted weight gain. You can have things like difficulty with your regulation on a regular basis. Working in conjunction with the colon and the stomach, we can have those IBS symptoms. Indigestion problems. You have to be very particular about the things that you eat. Well, this is very, very important because when we look at the colon, we look at the stomach, and we look at the small intestine. There's three, we call that as a unit the gut. And 80% of your immunity comes from the gut. Very, very important for people to understand that our immune system has to have fuel, it has to have activations. We have to have proper proteins, carbohydrates, and fats. We have to have proper enzymes and hormonal control. So when we talk about the gut, we don't just have a thyroid problem, we have a gut issue. And when we have a gut issue, we have a thyroid problem. So they have to work hand in hand. But the gut can cause the thyroid dysregulation, dysfunction. The next thing I'm going to talk to you about is we're going to talk to you about blood sugar. Now, our normal blood sugar should be from 85 to 99. And if it's unregulated, we can have it decrease or we can have it increase. But that blood sugar is very, very important because if your blood sugar goes too high or too low, you can become symptomatic. And when you're symptomatic and your blood sugar is giving you a problem, we can have inward trembling. We can have agitation. We can have a difficulty as far as not having an appetite. We can have an excessive appetite. We can get headaches. We can have nausea. So it's very, very important as far as regulating your insulin levels in the pancreas for that blood sugar to be leveled out. Because your insulin levels, once again, has to work in conjunction with your blood so that your body can get nourishment and we can have normal function. Now, the next section that I want to talk to you about is your adrenal glands. When we have problems with adrenal glands, you might be experiencing afternoon fatigue. You might be experiencing things like the headaches that we discussed earlier. You can be experiencing nausea. You can get vomiting. You can have other issues. But your adrenal glands are very, very much considered your stress glands. So emotional, chemical, or structural stress can actually affect those adrenal glands. When your adrenal glands are not functioning properly, we can have a spike in your cortisol levels, which in turn is going to go back and affect the blood sugar levels. Okay, and so when we have adrenal problems, the cortisol is not regulated properly. We can also have epinephrine and norepinephrine surges or drops. And so when we have adrenal problems or we have blood sugar problems, we can have the thyroid problems. So we don't just have a thyroid problem here. This is a web of physiological dysfunction, and hopefully you understand that the adrenal glands, the blood sugar, your small intestine, stomach, colon, and the three areas of your brain that I just talked to you about are all integrated into regulating how your thyroid is going to work. So as we look through and we look at the big picture of thyroid dysfunction, I want you to understand that if your doctor has not discussed this with you, he's cutting you short. And we're treating you just simply symptomatically. Now, our office does things differently. We're very, very unique in that we look at to uncover all the causes of your thyroid dysfunction. We're going to provide you with an examination. We're going to review all of your blood work. Very often, the blood work is not complete. We run 7 to 9 different markers for thyroid. Most likely your doctors probably just run TSH or TSH and T4. So very often, we're not looking at people from a functional standpoint when we go to a traditional medical doctor. And that's the reason why, once again, 90% of hypothyroid patients are still experiencing symptoms, even though they're on the medications and your doctor's overviewing your case. So I want you to understand that you can put this behind you. I can help you to get the regulation that you deserve, not only from your thyroid, but also the underlying causes of why you're having the problems in the first place with your adrenals, with your blood sugar, your gut function, and the brain. Your hypothalamus will fire, the part of the brain once again, will fire down to the pituitary gland, which then fires back down into the thyroid. So when we look at this cascade, if we have a problem anywhere in between, then we're not going to have a normal thyroid function. My name is Dr. Michael Corey. I hope you've enjoyed these few minutes that I've spent with you. If you have any questions, by all means, call my office at 714-730-5833, or else you can catch us on the web at octhyroidrelief.com. My other website is wellnessstop.com. There's 3 S's in there, so it's wellnessstop.com. My name is Dr. Michael Corey. Thanks so much for spending time with me, and I look forward to seeing you on future videos.